Today we are going to be demonstrating blood glucose monitoring, drawing up insulin, as well as inserting insulin. So the first thing I want to do is I want to verify my physician's orders, which I have done, and now I want to identify my patient. Hey, Mr. John, I'm Allie. I'll be your nurse today, and we're going to do a blood glucose check. So will you please state your name and date of birth? Perfect. All right, so I want to go ahead and perform hand hygiene and don clean gloves, and I'm going to have Mr. John here wash and dry his hands. All right. So now that I have put on clean gloves and performed my hand hygiene and he has performed his hand hygiene, we are going to go ahead and turn on our blood glucose monitor and insert a strip. All right, so now that that is done, I am going to select a finger and I'm going to go to the lateral side to the very tip of the finger, and I'm going to go ahead and clean this with an alcohol swab, and I'm going to allow it to dry completely. I'm going to take my Lancix and I'm going to prick the finger. I'm going to wipe away the first drop of blood with a cotton swab, and then the next one I'm going to use for the blood glucose, and I'm just going to allow them to touch, and I'm going to make sure my patient is no longer bleeding. I'm waiting on my results. My results have came up, so I want to go ahead and turn off my meter and disinfect it. I want to then perform hand hygiene and remove my gloves, and then I want to explain the results to my patient. Hey, Mr. John, your blood glucose was 252, so we're going to go and get you a little insulin, and then I want to document my procedure. So for the insulin administration, what I want to do is I want to verify my physician's orders. I want to verify my physician's orders match the MAR, and then I want to identify my patient. Hey, Mr. John, will you state your name and date of birth for me? And do you have any allergies? All right, so now that I have identified my patient, I'm going to perform hand hygiene, and I'm going to go ahead and don clean gloves. I'm going to do a focus assessment. I know he needs insulin because his glucose reading was high. I'm going to go ahead and figure out which site was used last for insulin, which his was on the right, so we're going to go ahead and use the left abdomen. And so after my focus assessment, what I want to do is I want to go and get my insulin from the Omnicell. I want to verify my insulin with my MAR, and I want to check the expiration date on my insulin, and they are within date. So now I want to roll my insulin. All right, so after I have done that, I want to go ahead and draw up my insulin. Both of these have been used, so I do want to scrub the hub on these, and you're going to scrub for 30 seconds. All right, so now I want to draw up my insulin. We are going to be given 6 units of regular insulin and 16 units of the NPH insulin. So total we're going to have 22 units. So I want to aspirate air into my NPH, and that's my 16. So I want to go ahead and pull up 16 units of air, and I want to insert it into my insulin without touching the liquid. All right, so now I'm going to draw up 6 units of air, and we're going to insert this into our regular insulin. And now I'm going to go ahead and draw up my 6 units. All right, and next I'm going to go ahead and draw up my NPH. And this one is 16, so I'm going to draw all the way to 22. All right. So the next thing I want to do is I want to have another nurse verify my insulin. I also want to label this if I've done it outside of the room, and then I want to do my 3rd check at the bedside. Okay, so now that I have drawn up my insulin and I have done my 3rd check at the bedside and it has been verified, I have picked my site. I want to go ahead and clean my site with an alcohol swab in a circular motion. All right, so with insulin, if you pinch it 1 inch, you're going to go at a 45-degree angle. If you pinch it 2 inches, you're going to go at a 90-degree angle. So I'm going to pinch 2 inches, so I'm going to go at a 90-degree angle. I'm going to be gentle and insert that. I'm going to slowly insert my insulin. Okay, I've done that, and I'm going to cover with an alcohol swab, and then I'm going to discard my needle in a biohazard bag, and then I'm going to perform hand hygiene And then I want to document my procedure, my site that was given, as well as my patient's response. And that is insulin administration.